All right, let us talk about the lymphatic system. The lymphatic system is also frequently referred to as the immune system because it has a lot of immune functions that are tied into it. So what does the lymphatic system do? Actually, let me start up here. So the lymphatic system is going to collect and return tissue fluid back into the bloodstream. Not all fluids that exit at the capillary bed are reabsorbed, so the lymphatic system is going to aid in that reabsorption. Where also the lymphatic system is going to be what is responsible for absorbing fats in the small intestine and is going to be involved with producing functional white blood cells. Functional is the key term there. And then because of the white blood cells, it is going to aid in defense against pathogens. So an overview of the lymphatic system. The lymph nodes are going to be found in clusters and groupings, and everybody knows about lymph nodes, but they're more like the middle of the lymphatic system. So what's going to happen is actually you will have lymphatic capillaries, very similar in size and shape and some function to the blood capillaries that are going to be intertwined in the capillary bed and around the arterioles and venules. These capillaries are going to function much like veins in the fact that they are going to merge together, getting bigger and bigger and bigger, and they're going to have valves embedded within them. Now, these lymphatic ducts is what they're actually referred to. They're going to pass through lymph nodes. These lymph nodes, as I mentioned, are found in clusters and are going to basically kind of act as a little bit of a filter. We'll talk more about them in detail in a moment. Eventually, the lymph vessels will pass through the lymph nodes into the lymph trunk. The trunk is then going to dump out into the vena cava right before it comes back to the heart. So this is referred to as an open system. Now, how's it involved with the small intestines and fat absorption? So here we can see a villi, a microvilli, which is a finger-like projection on the luminal or apical surface of the epithelial tissue found in the small intestine. These microvilli increase surface area, and in these microvilli we will find pouches or extensions, I should say, of veins, arteries, and a lymphatic capillary. And we can actually see that right here. We have blood capillaries here, arterioles, venules, and we have a lymphatic capillary. In the small intestine, they're actually referred to as lacteals. Not to be confused with luteals, lacteals. And they're going to pick up fat. Now, the lymph nodes themselves are going to be divided into two regions. They're going to have an outer region referred to as a cortex and an inner region referred to as a medulla. Anytime you see cortex, think outer region. Anytime you see medulla, think inner region, because a lot of organs and organ likes, so glands, in the human body have a cortex and a medulla. Now, in a lymph node, the cortex is going to contain B cells and T cells and are going to be involved more in a immune protection response, whereas the medulla is going to have lymph sinuses and macrophages. And this is going to filter for foreign particles and pathogens. All right. We have major clusters of lymph nodes, and Some of them you may be aware of, some of them you may be able to feel if you have certain conditions going on. So let's start with the cervical nodes. The cervical nodes can be found in the neck, and they actually extend up the neck into the head and underneath your chin. If you've ever had a cold or something, a bad respiratory infection, and you've extended your chin up and you can feel like this hard, painful nodule in the soft part of your chin, that's a lymph node, a swollen lymph node specifically. Lymph nodes are going to swell when they are actively fighting something. They're not just passively, collecting foreign particles and filtering stuff. They are actively and aggressively going after something that they're picking up in a particular region, which is why things like the axillary nodes or cluster is really important. The axillary node is one of the first places that breast cancer metastasizes to. So when they're checking to see if breast cancer has metastasized, they're going to biopsy the lymph nodes in the axillary region on that side. Now, the axillary nodes are going to do a lot of filtering from the chest cavity, but also from the associated arm. We're going to have clusters down at the inguinal region. So right along your groin, you're going to have clusters of nodes there on each side. And just think about the entrances and exits that are in that region, male or female. There's a lot of possibility for pathogens to get in, and so these nodes are going to be critical to help prevent that. We're going to have a slew of clusters wrapped around your gut. They're found everywhere around your gut organs. Okay. So the lymphatic system is typically said to be composed of two semi-independent parts. One is that meandering network of lymphatic vessels, and then the other is the lymphoid tissues and organs scattered throughout the body. Lymphoid tissues include things like lymph nodes, but also include things like the spleen and thymus. As we mentioned, it helps return interstitial fluid and leaked plasma proteins back to the bloodstream, and we call it lymph. The fluid that is actually flowing through the vessels is referred to as lymph, not interstitial fluid. Just re-showing. Lymphatic capillaries are very similar to blood capillaries, except they are more permeable. They are going to have loosely joined what we refer to as mini valves that are able to withstand interstitial pressure, and these capillaries are going to remain open always. These mini valves are going to function as one-way gates to let interstitial fluid in, but not allow it back out, and then allow it to go in one direction only. Now, when you have an inflammatory response in the tissues that these particular lymphatic capillaries are located in, they are going to absorb not only interstitial fluid, but any cellular debris from the healing or damage process, as well as any pathogens that are in the region, any cancer cells that are in the region, and that's going to be important for when we get into the lymph nodes. As I mentioned, the lacteals are going to be specialized ones that aid in the digestion of fat. The lymphatic vessels, once they're no longer capillaries, are going to have 3 layers or tunics, just like the veins. Just like the veins, they're going to be very, very thin layers. A lot of internal valves are going to be found here as well to prevent that backflow. They are typically going to run along superficial and deep veins and arteries. Nutrients are going to be supplied by what we refer to as the branching vasa vasorum, which is simply a network of small arterioles, capillaries, and granules that supply the outer tissue of large blood vessels. So again, this is a self-supplying system, making sure everything gets everything that it needs. The lymphatic system does not have a pumping organ. It is not connected to the heart in any way, shape, or form. Therefore, the vessels of the lymphatic system are going to be low pressure and are going to use the same methods as your veins to get this lymph back to the vena cava. So pulsations from nearby arteries, and then contractions of smooth muscles in the walls, contractions of skeletal muscles that are around them. Same thing that we talked about with venous return will be here. All right, the spleen. The spleen is the largest lymphoid organ. It's located on the left side of the abdominal cavity, right beneath the diaphragm. And the spleen's function is to remove old and defective red blood cells and platelets, as well as any other foreign matter and debris from the bloodstream. So the spleen is tied directly into the bloodstream. The spleen also acts as a reservoir. You hold about a pint or two of blood in your spleen. So if you donate blood, if you lose blood, your spleen is able to replenish and replace that blood. And then you just have to replenish and replace the blood that the spleen is storing. This is also going to be a site for lymphocyte proliferation and for immune surveillance and response because of the foreign matter that it cleans out of the bloodstream. Can you live without your spleen? Yes, there are things called splenectomies where we go in and remove the spleen because it's being more of a hassle than it's worth. Is it life-altering like removing the gallbladder? Yes and no. Your immune response is compromised. Your ability to clean your blood is also compromised. So you are going to want to be aware more of where you are and what you're doing to compensate for that. The thymus. Now the thymus is going to be very, very different from other lymphoid tissues because of a couple of very important reasons. One, the thymus is located in the chest cavity, right at the top of your sternum, and it is at its largest when you are born. Now, the other thing that's going to go on with the lymph is the fact that, the thymus, is the fact that it is going to start to shrink around the age of 20. So by the time you hit old age, you basically have no thymus, which can be slightly problematic. Now, why is that slightly problematic? Well, the thymus is going to be involved in T lymphocyte maturation, and only T cell maturation. It is the only place where T cells can mature. So if you have no thymus, you do not have any new T cells, which can cause problems. This is partially why we believe, now that we know what the thymus does, that those who are older tend to have issues with their immune response. So, like, for the most part, for most people, the flu is not deadly. We get a little dehydrated, we get a little sick, and we bounce back just fine. The common cold, typically not a big deal. Whereas our older patients, they catch everything under the sun, and instead of being something minor, it's something major. This is part of the reason why We were so concerned with COVID because it was going through not only people who still had functioning thymuses and they still had a decent amount of T cells, if it was, and it was causing issues with them and a high death rate, what would it do to the elderly population that has very limited T cell response and already has issues with things like colds and flu and pneumonia? So that's part of what was going on.